Hello friends, today I am going to give you information about the hair fall, also called as the alopecia, diffuse alopecia. We also call in Hindi or Marathi case garne or bal jhadna. In these cases, there are two types of alopecia or hair fall. One is the male pattern baldness that is found more in male, and another is the female pattern baldness. This both male pattern baldness and female pattern baldness is a hereditary hair fall. So this can appear in the male and female also. Another classification of alopecia is the diffuse alopecia and localized alopecia. In case of diffuse alopecia, we get the diffuse hair fall, and in case of localized alopecia, we get the localized area alopecia, that is also called as alopecia areata. Another classification according to the etiology, there is the physiological alopecia and pathological alopecia. In many cases, if the hair cycle is imbalanced, then we get the physiological alopecia. And in case of pathological alopecia, we have to find out the etiological factor why this alopecia is there in the scalp. After understanding the alopecia or hair fall, then we will come to the investigation and treatment part. We have to do the first trichoscan, hair scanning. In this hair scanning, we just do the scalp analysis of hairs. In this, whether we see the density of the hair, we see the velocity or terminal hairs, what is the percentage of that, we see whether there is any dandruff or any seborrhea into the scalp, and any other pathological factor to the scalp. After knowing the scalp analysis, we just plan out the treatment. Again, the treatment plan is very simple. We have to go for laser therapy, which helps in the stimulation of hair follicles and hair start growing. Another is the UVA and UVB therapy, that again going to help in the hair stimulation. Another one is the cryotherapy. Another one is the PRP treatment, where we use the platelet-rich plasma. Another is we use the hair solutions with derma rollers, and again we get the hair root stimulation and we grow the hairs. But in such alopecia, where there is a scarring alopecia, where we won't get the hair follicle in the scalp, then we have to plan for the hair transplantation therapy. And by hair transplantation therapy, again we are just growing, applying the new hairs, and the new hairs start growing. And once the appropriate treatment is over, then we have to take the universal hair precaution so that the further alopecia is to be prevented. For females, the universal precaution is that for every female, they have to wash their hairs twice in a week. They don't use the hair dyes or chemicals on the scalp. They should not use the hair dryer. They should not handle the hairs in a different styles. And in case of male, they have to wash the hair with shampoo once in a week, and at the same time they should not handle roughly the hairs. The main aim is that minimal handling of hair is the best way to prevent the hair fall. Thank you.